Well, once again, it just seems to be words, no kind of concrete action that we're talking about yet again. Let's make more sense of how the little one, how this 5-year-old is doing right now. We're now joined by Dr. Hema Divakar, consultant gynecologist, who's joining us from our Mumbai studios. Dr. Divakar, appreciate you joining us on the show. I'm going to talk about the kind of trauma that this child has gone through in just a moment, but we're talking about a 5-year-old who's gone without food, gone without water. What's the priorities for the medical teams that are examining her right now?
See, first of all, as how we started yesterday, the doctor saying, "Ghabrane ki koi baat nahi hai," and then we didn't agree with that because there's every reason for us to worry in the short term and the long term. So as how we had pointed out already, certain examination and the tests have to be done, and the response to the antibiotics, the response of this child to the serious medical condition that she is now in, the two words we constantly hear is, she is stable, she is critical. To a lay person it may seem stable, seems reassuring. Critical seems, something is wrong, and then they are worried about it. So both these contradicting things, what should it actually translate into? So as we had said yesterday that we are waiting for the reports, some reports are already in, but just the time, the next 24 to 48 hours will tell us how this child is doing. So in the short term, yes, there is a very good chance her life will be saved, but we are also, as medical professionals, worried about the long-term implication. What is the trauma to the vagina? What's the kind of sexual dysfunction she may have? Will her tubes be blocked because of this infection, and she may be a case of infertility? What is the psychological impact of this? There are so many ramifying things, not only with respect to this child, but I would like to tell everybody that every mother in the country today, because of this incident, everybody who has a daughter, may it be 3-year, 5-year, 10-year, 15-year, when we are empowering her with education, every mother today is worried to let her daughter go onto the streets, even for a late tuition class or an educational exercise or a sport activity. And it's such a psychotrauma to all the mothers in this nation and all the young girls who do not find themselves safe any longer. So that is a bit of a concern, not only medical but social also. So it has to be seen in the larger context, and I would say, instead of saying, will the parties unite, let's say the nation has to unite for this entire exercise to be put on track and something safer and respectful for women in the country.
Sure, Dr. Divakar. Dr. Divakar, I'm going to be coming back to you on this point that you